question is, at this EHA conference, you reported the breakthrough results of IMROZ research. Firstly, could you please introduce the background and main design of this study?
So the IMROZ study is a very large phase 3 randomized international study designed for newly diagnosed transplant-ineligible patients with multiple myeloma. The purpose of the study was to assess the clinical value of adding isatuximab, which is an anti-CD38 monoclonal antibody, to bortezomib, lenalidomide, and dexamethasone, referred to as the VRD regimen. So the VRD regimen is a very classical and very well-established standard of care for both transplant-eligible and transplant-ineligible patients. And so there is a lot of interest in CD38 monoclonal antibodies as well, and so we decided to investigate VRD versus isatuximab VRD for elderly, newly diagnosed multiple myeloma patients. So we enrolled 446 patients below the age of 80 years, and these patients were randomly allocated to either VRD followed by RD, or VRD followed by RD with a PFS primary endpoint.
The second question, in the IMROZ study, the ISA-VRD regimen significantly extended the progression-free survival PFS of patients compared to the VRD regimen. Can you explain in detail the advantage of the treatment combination? What is the therapeutic mechanism also?
So the primary endpoint of PFS was met with a median follow-up of approximately 5 years. The median PFS was not reached for ISA-VRD and was 54 months for VRD. So the 5-year PFS rates were 45% for VRD and 63% for ISA-VRD. So the hazard ratio was 0.59, representing a 40% reduction in the risk of progression or death. So that's a very clinically significant and very statistically significant difference between the two arms. Besides the PFS, we had some key secondary endpoints, especially complete response or better, or MRD negativity. So in the ISA-VRD arm, almost 75% of patients achieve a complete response or better versus 64% of patients in the VRD arm. MRD negative complete CR was seen in 55.5% of patients in the ISA-VRD arm versus 41% of patients in the VRD arm. And most importantly, we looked at, as in many other myeloma studies, in fact, we looked at sustained MRD negativity, and sustained MRD negativity was almost double in the ISA-VRD arm, from 24% in the VRD arm to 47% in the ISA-VRD arm. So this ISA-VRD regimen was associated with deep response rates, including for MRD negativity and sustained MRD negativity.
The third question, the IMROZ study not only focused on the progression-free survival of patients, but also on the safety of treatment and the quality of life of patients. Could you please introduce how the ISA-VRD protocol performs in terms of safety? In the IMROZ study, what is the incidence of adverse reactions compared to VRD? Has the patient's quality of life improved also?
Safety profile of isatuximab VRD was favorable, so this regimen was well tolerated. The safety profile was consistent with the safety of each agent, and these agents are well known in myeloma for many years. There was no difference in terms of quality of life. Quality of life remained stable and was equal between the two arms, with no negative impact of adding isatuximab. I should also have said that for survival, overall survival is still immature, but with a trend in favor of isatuximab VRD. The 5-year survival is 66% for VRD versus 72% for ISA-VRD, representing a 22% reduction in the risk of death. If you want to talk about safety in more details, we had a little bit more grade 3 or more adverse events, and also grade 5 adverse events in the ISA-VRD arm. But the treatment duration was very different between the two arms, and this is something we have to keep in mind. The median duration of treatment was 31 months for VRD versus 53 months for ISA-VRD, which is a a very large difference. And so you have, in this case, you have to look at exposure-adjusted incidence rates, and these rates were basically somewhat similar between the two arms.
The last question, what new development directions do you think will be in the field of multiple myeloma treatments in the future? And can we expect more effective treatment options to emerge for NDMM patients who are not suitable for transplantation?
So this IMROZ study will establish isatuximab VRd as a new standard of care for certain elderly patients with newly diagnosed multiple myeloma not eligible for transplant, basically patients between up to the age of 80 years. So that's a great achievement, and first we have to say that this will be a very strong and new standard of care with the median PFS will likely be over 80 months, which is quite long in this population. So this step is an important step. Then we will have other ways to improve on ISA-VRd, and generally speaking, we have currently studies looking at bispecific antibodies in newly diagnosed multiple myeloma, including for the elderly, and we have also CAR-T studies done for potentially for registration in the elderly patient in the frontline setting.
I would like to ask you the final question. What do you think about Chinese the doctors, clinics? What do you want to say to them?
Okay, I know your country quite well. I did many meetings in China. I will be in Shanghai at the end of this month, and I will likely be back to China before the end of the year. And I visited, let's say, something like 30 different cities in China in the past 15 years.
Okay,
so
you know
the good point is that your point is well taken, because IMROZ has Chinese patients, Chinese centers. As you know, the study has been published early June in the New England Journal of Medicine, and one co-author from Shenyang is from your country. The study I have presented this morning at the press meeting, and I will present at the plenary session tomorrow as Chinese patients. So we have 12 patients in this ITT population, but China had also an extension study, and so 12 patients are in IMROZ, and an additional 38 patients have been treated in a different Chinese study, which means that basically there is a group of 50 Chinese patients having received ISA-VRd or VRd in the context of this IMROZ study. So that will likely lead to approval by Chinese FDA. And so that the study is important for China in many ways, but it's also a good opportunity to congratulate and to thank Chinese investigators.